I'm the CEO of Camacol and welcome to Camacol Talk. This program is brought to you by the City of Doral, Baptist Health South Florida, City Place Doral, and Equitable Advisors. On today's show is Dr. Jose F. Llach. He is the Medical Director for Baptist Health Emergency Care Services. And today, we're going to be talking what's top of mind with everyone, the whole conversation regarding vaccines, in particular COVID, and we're also going to touch on the vaccine for influenza. So let's sit back and watch this conversation. Right, let me bring on to Camacol Talk, Dr. Jose F. Llach from Baptist Health South Florida. How are you today, my friend?
I'm doing great, Pete. Thanks for having me on today.
Thank you so much for taking the time. As we said off air, you're extremely busy. There's a lot happening in the world of medicine and health. And today, what we hope to do here is answer some frequently asked questions about vaccines, which is top of mind anywhere and everywhere you go. It seems to be the topic of conversation, not only in the medical field, but in business and even social gatherings. There's always going to be a mention about vaccines. So today, our hope is that we can go through some of these questions, answer them from your end, and kind of take it from there. So let me go with number one. Should I get the influenza vaccine since I'm getting the COVID vaccine?
Yeah, you definitely should. The reason why I'm bringing this up is the question you bring up, Pete, is the reason we bring this up because right now we're going to be going into flu season, which is typically between October and March. So what happens is that, that's actually, believe it or not, that's actually besides COVID in the last year, influenza is up there as well. It's something we need to consider all the time as well. So you definitely should get the influenza vaccine and the COVID vaccine as well. In fact, when you go to your primary care doctor's office, you could even get both at the same time.
Now, the influenza has, and this is a question from my end here, an observation. We haven't heard much talk about it. Obviously, because of the whole COVID thing, it has drowned out, and unfortunately, talk about any other type of medical challenge that one may have. And when it comes to vaccines, the influenza vaccine has kind of taken gone into the back burner a little bit off the radar screen. I guess it's because the whole COVID thing has been such an impact in the world. Have you seen, because what I had heard before is that before COVID, the influenza vaccine, the flu vaccine, was never at 100%. Not everyone took it. Did you, in your experience in the last year and a half, did you see a drop off even further than what typically we see with the flu shot?
It's a great question, Pete. Basically there has been a drop off in reference to the influenza vaccines in the country. The reason why we're getting this big drop off in itself is because of the measures that as a community we're all taking, where we have the hand hygiene, wash your hands for 20 seconds, the social distancing, wearing masks. That there shows to you and proves to you that that viruses are transmissible by these measures, by contact, by discussion, basically being in the same room with somebody else, and aerosolization of the virus to another patient. So it actually shows that what we've done in the community, especially in Dade County, is helping basically bring down the influenza numbers. Me as an emergency room physician, I've definitely seen that the numbers of influenza have gone down tremendously from years past. And a good point you bring up, Peter, is basically about the vaccine itself. If we get the vaccine, how good is the vaccine? And the influenza vaccine is not 100% effective. Great point. I completely agree with you. It's actually about 60% effective, the influenza vaccine, as well as the COVID vaccine. So there is a protection about 60% of the time. It's going to protect you from getting really sick or sick in itself. But there are the measures that we've all been taking as a community in South Florida that protect us and thus preventing the transmission of these viruses among us.
Absolutely. And I think you just mentioned before this question that you can actually take both influenza and COVID vaccine at the same time?
Yes, good point. Yes, and the one thing you want to make sure is that if you have certain conditions, like if you have HIV, if you have a no spleen, basically, or patients who are immunocompromised in itself, you could get both if you're immunocompromised, but if you have no spleen in your body, because let's say you have like a car accident, you have to take your spleen out or whatever it may be. If you have no spleen and you have advanced HIV, not just HIV, but advanced HIV or untreated HIV, those are the kind of patients that don't want to get the influenza vaccine and the COVID vaccine together. But overall, pregnant, children, or basically, children or teenagers greater than 12 years old, the elderly, definitely you want to get the COVID vaccine and the influenza vaccine at the same time. That's per CDC recommendations.
Um, is there any better time to get the influenza vaccine? Is it something that I should be thinking about getting soon?
Great point. Yeah, you definitely want to get the influenza vaccine, especially now during the time of the flu season in itself. And the question is, why now? Why do we get the flu vaccine during the winter time? The reason why is because viruses are transmissible more is basically in the winter, because in the heat, the summer itself destroys the coat, basically the capsule of the virus. So in the summer, we don't see too much influenza. But in the winter, we do see it's less hotter in Miami or in Dade County. So we do see a lot more transmission of the virus. So we definitely want a time to get this vaccine when the viruses increase in itself, which is in the wintertime. And believe it or not, the month that is more transmissible for the virus influenza is actually in February. So you want to make sure you time it at least a month or two or even 3 months before January, February, especially also before you meet with your family and the holidays and all that, where you're going to be among others. So you want to time yourself at least. Now's the time to get it. Maybe September or October is definitely the time to get the influenza vaccine.
Dr. Llach, I really like what you just said right now when the weather is less hotter because
Yes.
it's always hot and warm in Miami. And our four seasons, I always chuckle. I saw this photo for a while back where they show four different photos, but they're all the same. The start of winter, the start of spring, the start of summer, and the fall. So it's less hotter, but it's going to be hotter here. Getting back to the COVID vaccine, not getting this vaccine, uh, what does it do in terms of the percentage or danger of me getting COVID if I don't get the COVID vaccine?
That's a great question. Basically, I'm not sure if you guys know, but an article came out over the weekend in the Washington Post where the COVID vaccine, I'm sorry, if you don't get the COVID vaccine, you're at 11% chance of getting sick and very sick. So it actually increases almost by 10% of you getting really, really sick from not getting the COVID vaccine. So I would highly recommend the COVID vaccine because it definitely protects you from getting sick. And I would be quite honest, I am seeing this with my own eyes. I am telling you with my own eyes. I am an ER physician in Dade County. I'm treating lots of patients on a regular basis, where we basically get 9% of the patients who are admitted to the hospital are non-vaccinated. And it shows literally, where science is teaching us right then and there that this vaccine does help. 90% of the patients who are admitted are basically our non-vaccinated patients, which is impressive. This is seen beforehand, and history is being made, and it's at the present time, protecting due to this vaccine.
How many of the patients that are going through ER and being admitted because of COVID, how many of them have had the vaccine? What you've seen?
Great question. So basically, the question is, I just want to mention the question, Pete. So basically, is those who have been admitted, have they been vaccinated out of the COVID in itself?
Well, the ones that have been vaccinated. Okay.
Those that are
How
vaccinated,
many
yes.
of the COVID patients you